The Hospital Association calls the situation dire and says if those balance sheets don't start adding up soon, it could mean hospitals will start cutting services, cutting beds, and could even face closure.
We're seeing real-world impacts starting to happen.
Providence closed down pediatrics at their hospital, right? Or reduced services because there's just not enough beds.
A survey from the Washington State Health Association shows that both urban and rural hospitals are in financial trouble statewide.
We've got the potential of seeing hospitals close in the next year.
Eric Lewis says the survey shows that while revenues increased 5% in 2022 over 2021, expenses far outpaced them, growing by 11%. The total net loss for the hospitals was a massive $925 million for the first 3 months of 2022.
This is a negative 13% net loss, and this level of losses is unsustainable.
Lewis says reasons for the losses include low Medicaid reimbursement, which hasn't had a rate increase in 20 years, with some hospitals reporting payments covered just 42% of costs. High inflation and labor shortages also played a role, along with a 200% increase in temporary labor spending and a large number of patients being unable to transfer into long-term care or nursing facilities when needed.
Today, we have over 45 patients that do not require our services, that need some type of long-term acute care.
At Evergreen Health, Chief Nursing Officer Mary Shepler says the cost for the patient's care is around $1.3 million for 1 week, with 1,600 excess days total in the hospital.
All of us are slowing down on non-urgent and emergent surgeries. These are, I always think about it, patients with knee pain, back pain need those surgeries, right? But we're slowing down those services and delaying them because of our current situation.
The WSHA didn't have specifics on a timeline or which hospitals could close, citing an $8 million state emergency fund that some hospitals will apply for, but did say the situation is concerning overall.
There's some rural hospitals, because of their low cash position, are at risk of closing the next year. But the urban hospitals, the losses were so large in the first quarter. I mean, ultimately, their financial viability is threatened.
Survey responders believe that maternity services and behavioral health services could be the first to go if hospitals are forced to take action. Jennifer Dowling, Fox 13 News.